Dr. Shupek, this is a 14-year-old with diabetes insipidus, vomiting, and headaches. We've got many sequences here to share with you, but we're going to focus on the sagittal T1, the sagittal T2 fast spin echo, and then obviously there's contrast enhancement of this abnormality in the supracellular and intracellular territories, makes that snowman type phenomenon. And bear in mind, this is a pediatric case. It is a male, it's a man. So what's our differential diagnosis here?
Right. So the cella is not enlarged. So this is primarily a supracellular mass enhancing in a child. So there is a substantial differential, which could include things like a germinoma, sarcoid, eosinophilic granuloma, things of that sort that affect the stalk and are in that differential of diabetes insipidus, which this child does present with. Now, I would say from the surgical standpoint, nobody is going to like that idea very much. Nobody wants to dig into anyone's hypothalamus. So we're going to really go to lengths to try to make a diagnosis, including CSF studies, and just really correlating all the other things that we can in terms of age and whether there are other findings elsewhere in the brain that would help us. So I think that's kind of our differential lymphoma maybe, but given the age, you know, I would say germinoma is going to be up there.
And I think the person that read it favored germinoma and eosinophilic granuloma. You know, had it been an adult, you might go, you know, you might include things like neurosarcoid, although that can occur in any age range. Metastasis to the supracellular region, especially breast and lung, by far are big. And then when you have, you know, stalk involvement, there's some really weird things like pituocytoma and not so weird things like lymphoid hypophysitis, but that's more of an inflammatory, infiltrative, immune-mediated process. So this is a mass as opposed to a non-mass-like enlargement of the stalk region. And, you know, in my simplistic mind, I think what you were saying is big supracellular lesion, you know, young, otherwise healthy person, it's a juicy cella, but it's not really a cellular mass.
Right.
Almost everything we're seeing is up here, and maybe it's infiltrating down below, maybe not, but it's not producing a heck of a lot of expansion. So germinoma is something to strongly consider here, and diabetes insipidus is particularly prevalent in patients that have germinoma and stalk-related disease.
Now, I guess hamartoma, the enhancement kind of rules that out.
Yeah, hamartoma's out. You know, you like those to be, you know, more in the region of the tuberous cinereum. The epicenter should be a little further back, closer to the mammillary body. I think the epicenter's over here. Hamartomas don't enhance. They're usually associated with gelastic seizures or behavioral change, or sometimes they're associated with growth delay, occasionally with epilepsy. But diabetes insipidus, it can occur with a hamartoma, so that certainly doesn't rule it out, but it points a little bit more towards germinoma. I'll tell you what else points a lot more towards germinoma besides the enhancement. Hamartomas don't enhance. Is this little funny nibbin of growth superiorly headed towards the third ventricle. You don't see that with hamartoma, and we know that germinomas like to seed the cerebrospinal fluid. Now, even though these are more common in males in the male gender in the pineal region, in the supracellular region, some people think a little more common in females. Some textbooks say males equal to females, but there's no major gender predilection. 90% of these present before age 20, and our patient is 14, so fits that criteria. Diabetes insipidus, super common. You can check that box off. Panhypopit, because of infiltration of the pituitary, which is probably occurring here, is another thing to be on your guard for. You know, they can present rather acutely with decompensation in cortisol due to the lack of ACTH, or they can even present with hypothyroidism due to decline in TSH production. These things are incredibly radiosensitive. They're often curable. I know this patient did not get surgery. The patient got radiotherapy and chemotherapy, and there's a 90% 10-year survival for these. Anything else clinical about, what about HCG, you know, an alpha-fetoprotein in these?
Right. That's part of this workup for cellular, supracellular, but particularly very similar to a pineal region workup, which would be looking at CSF to characterize germ cell lesions and other things in the pineal region. So it's very common, as you mentioned, that the presentation of the suprasellar, of the pineal region ones in males. That's the characteristic one with Paranode syndrome. Okay, upgaze, retraction, nystagmus. You know, you might not have heard about that one. Light near dissociation. Okay, so you can kind of reacquaint yourself with that one if you're thinking about germinoma. This is kind of a relation to the pineal region ones.
That's a good clinical pearl, and of course, germinoma associated with HCG elevation, more frequent in the CSF. Occasionally, you know, it can spill into the blood. You get a blood elevation, and alpha-fetoprotein points more to, you know, embryonal cell or pteridocarcinoma as opposed to germinoma. So this is a germinoma. It's proven surgically. It responded extremely well, as they usually do, to radiotherapy, and in this case also chemotherapy. There wasn't a lot of seeding present, and I'm ready to move on to the next one. How about you?